I'm Jen and I live in rural New South Wales on a property just outside of Armidale. I think people would be able to find my location best that way. I live on a mixed grazing property with my husband and my two beautiful boys. I am a mental health clinician, a researcher, and a podcaster, because that's now a job title, apparently. And I am one in four. I have suffered miscarriages and infertility. So, yeah, that's a bit about me. A little bit about my miscarriage experience. I've had two miscarriages, both missed miscarriages, which I think is a lot that people don't know about until it happens to them. That certainly was my experience. Our first miscarriage was shortly after we were married in 2016, and it really came as a bit of a shock because I wasn't really sure how fertility worked. I thought that you were fertile just before your period, and I got that very, very wrong. And so I totally missed all the flags that I was pregnant, and it wasn't until a doctor was like, let's test that you're pregnant, that I found out that I was pregnant. But at the first scan, which was about that 10, 12-week mark, I actually found out that we weren't. So we went through this roller coaster of emotions all at once, because it was kind of confirmed that I was, but I wasn't. And so there was no really kind of time or space to have any joy or sadness, because living rurally, there wasn't a lot of services for me to kind of jump into. And so I kind of just had to jump in the car and head to Sydney and find a private OB down there that could give me some services. In 2019, it was really different. I'd already linked in with that OBGYN, and she confirmed my miscarriage. And it also really confirmed for me the gap in health services that rural people receive. From my first miscarriage to my second miscarriage, my second miscarriage was confirmed in the ultrasound again, but my OB walked across her rooms and sat with me while I cried. And then within 2 days, I was receiving services to try and remedy my situation. So it really lightened up the rural health gap for me of what patients are missing out on. So in 2016, when I had my first miscarriage and I was using primarily rural health, I think the backbone of rural health is GPs, and they are so busy and overworked and underappreciated. And my GP did the best she could at the time. She offered follow-up HCG levels, but I think when you're living in that anxiety of, hang on, someone said I've had a miscarriage, but you're saying wait, and you're holding a lot of space, it just kind of is the breeding ground for anxiety in subsequent pregnancies, which is what I found out, suffering from perinatal anxiety. But so I just had to hold a lot of space and wait. And that really wasn't what I wanted to do. I wanted somebody to kind of remedy the situation for me. And I found that I couldn't just get into an OB locally. There wasn't a private one available to me. So I could go and attend a clinic down in Coffs Harbour, or I could hightail it to Sydney and receive services there. So I guess I didn't really have any services. So I found a real lack of services probably contributed to my anxiety, and feeling really kind of not in line with my body. My mind knew one thing, but my body knew another. And I guess I was just seeking a service to remedy my situation so that my body and my mind were on the same page. For me, I needed my situation remedied. I just couldn't hold a lot of space, and I felt like I was mentally spiraling from the experience of not being incongruent with my body. And so while I was able to physically fix it, because I'd sought those services outside of my local community, there was no referral point back. So I actually ended up, it wasn't until my subsequent pregnancies where I was really suffering from perinatal anxiety about the losses I'd previously had, that I actually had to ask a GP to refer me. There just wasn't a service that anyone had thought to loop me into or to discuss. And even then, locally, being a mental health clinician, I had to ask to be referred into the to different programs that exist. I guess I am super passionate about those first 1,000 days. Being a perinatal and pediatric mental health clinician myself, I'm super passionate about training the next generation of clinicians that are going to come through, because we don't last forever. And also supporting rural women and men and families who find themselves in these situations. Rural health, particularly after COVID, has exponentially it's headed towards a crisis. And I don't say that lightly, and I don't say that to undermine anyone who currently works in rural health. They just are so under-resourced and underfunded and all of those things. So I'm really passionate about that space of getting the services that rural people need creatively any way that they can, and sharing the voices collectively of their experience so that people aren't dismissing them or they're not being heard. That yes, they can be creative and resilient, but at the same time, we should be ignored just because of our postcode. Traditionally, rural people don't really talk about this type of stuff. I know my husband and I spent a lot of time talking about it, and we certainly approach it differently now that it's happened to us. We certainly try to hold space for our friends who have had it, and I certainly push Chris, my husband, to particularly reach out to the blokes and be like, hey guys, this happened to you too. Are you okay? So we definitely approach it differently now, but I think rural people traditionally are quite private people. They're often quite conservative, and they don't want to talk about this stuff, or they have to move away from it and it doesn't happen in their local communities. And so the supports aren't there and people aren't privy to the information to support them. So yeah, I mean, we planted a tree in our garden to honour our losses, and I certainly have gifted the children's rose to friends of mine because they were gifted to me. But I think traditionally we don't talk about it. We don't have a lot of ceremony or support in miscarriage and baby loss because it's hard to talk about. There was definitely a lot of things that contributed to making my loss harder. I think education around loss, and I feel like I was young and naive, and I don't think that we talk to women in childbearing years or even in sexual education about how common miscarriages are and what actually is entailed in a miscarriage and what you can expect after even a D&C or taking medication, or God forbid if it happens at home to you on a toilet or in a shower. So one, I think that is huge, but I also think the time that rural people spend holding space waiting for treatment can be really quite traumatizing, and the breeding ground for subsequent perinatal anxiety. Rural people are really, really diverse. I think giving consideration to the services or lack thereof in each individual community. So often mental health is layered, and doing things for yourself is a very easy way for people to be like, carve out some time for yourself, go and do something. But often, particularly rural mums or farmers' wives, really struggle with that. They're going to town maybe once a month, maybe once a fortnight. And so finding time to be able to carve out for themselves is really difficult. And their proximity to town and connection with people, clinicians might not realize that the only time that person has had contact with another human being that they can actually emotionally dump on is the clinician through the screen. And so holding space for that person, they might not actually want to get so deep into the evidence, and just be a therapeutic dumping ground for that person in that time might be the most spectacular thing you could do for them.